That's going to be a big issue in the next 2 years is the pre-existing conditions. So what happens to all those people who got sick with COVID? That's
Right.
that's going to be a pre-existing condition. And now these healthcare companies can come in and say, you know what, you had COVID, we don't want to cover you. You're at high risk. You're at high risk to get sick again, or maybe to get lung damage or cancer or something. We don't want to cover you now. And I don't see anybody talking about that at all. And I'm just sitting here saying, hey, look, we have an issue. You see what they're doing, pre-existing conditions. Now,
Mm-hmm.
in a year from now, when, maybe it's a couple million, 15, 20 million, who knows
It's
how high
millions
that
of
number,
people.
they'll be excluded from health insurance because they had a pre-existing condition with COVID. And how many of those people maybe have the Affordable Care Act, who have Obamacare, or how many of those people have Medicaid, or private insurance plans, not Medicaid, and they can't get these programs. It's just, and then we see what the Trump administration recently did with trying to get the pre-existing conditions clause struck out of Obamacare. That's going to affect a lot of people in the long run. And it's like, we have to be smarter than this.
Yeah, definitely. We definitely need to be smarter about it. And I don't think people even realize or even thought about what it is that you just said, that anyone that had a positive COVID test is going to be someone that has a pre-existing condition, because we still don't know what COVID is did to you, or is it going to do to you in the future, right? Like, is it something that's going to lay dormant and all of a sudden something else is going to happen moving forward? We don't know. So you're absolutely right. And I think the insurance companies, at the end of the day, they are really about making their money, and they may not want to take the risk of like insuring someone and they don't know, how good or bad that's gonna turn out.
Exactly. Yeah, exactly. I mean, that's going to be a big issue. And, I'm keeping that on my watch list as something, maybe opportunities to legislate. And we don't know the potential impacts of that yet, but we have to really go with what the science is saying and try to get ahead of it. We react instead of being proactive, instead of trying to prevent, instead of trying to get ahead of things. We need to get ahead of it. We need to think about these long-term, have bills already drawn up, get to the drawing table, be ready. So if something like this, if we find out this is going to have a bigger impact on people and insurance companies are going to act in a specific way, which they probably will, then we need to be ready to introduce those bills, get them through the committees, get them through the entire process to help as many people as possible, not have their health insurance stolen away from them.
Right.